Congressman Christensen, do you want to start? Okay. Good morning. It's hard to think that we've done this 11 times. This is the 11th time we've done this. And in the course of 11 years, lots and lots have changed. Changed because of you and what you've done, and changed because of what some of the folks who are going to bring you greetings this morning have done. And I think my personal thoughts about this particular meeting is that this is a time of reflection about accomplishments obtained and opportunity to think about the future. If I had to describe it, I would say to you that over the last couple of years, we've cleaned up business of the 20th century that had to be done, that still brings controversy and discussion as people still think of healthcare in sort of 20th century frameworks. But now we're at that bridge point into the 21st century, where what we begin to accomplish here, the generations of 2030 and 2040 will hopefully look back at us and appreciate the challenges that we took on and the directions that we laid and the opportunities that we presented to them. So we're going to talk a lot about that over the course of this meeting. And I think what you'll also find is that this is not a talking head session, but really we've got some very particular challenges that we want to discuss with you and take the opportunity to address. It's also with some real feeling and emotion that I bring Congresswoman Donna Christensen, who's been a partner for 8 years. We have together worked on this event, and it's sad to think that at least this part of the journey is over, as other challenges and opportunities present themselves. I just really want to say it's been a tremendous honor. I know it's kind of an interesting way to begin an opening session to reflect so much on the past, but it's been a good past. It's been a great opportunity, and I really want to thank her. So Congresswoman Donna Christensen.
Thank you, Gary. Good morning. And welcome, everyone, to the National Minority Quality Forum 11th Annual National Summit on Health Disparities in the 2014 Congressional Black Caucus Spring Health Braintrust. As you've heard, these will be a couple of bittersweet days for me. We have 2 dynamic days of outstanding presentations and speakers, but it's also my last year to be a part of this great event in my current capacity as chair of the Congressional Black Caucus Health Braintrust. And so while every year that we, the CBC Health Braintrust, have partnered with the National Minority Quality Forum has been such a great experience, and one that truly reflects what happens when great partnerships are established and preserved, this year is particularly special. And so I want to really thank so much Dr. Puckrein for his friendship, for his leadership and support over many, many years. And I want to acknowledge Gretchen Wortman also for playing such a pivotal role in what happens every April when we meet. I also want to thank those who are delivering greetings this morning and welcome them. Those who they've been long supporters and friends, both of the Minority Quality Forum and the CBC Health Braintrust. Dr. Icilma Fergus, the president of the Association of Black Cardiologists, Dr. Barbara McAneny, okay, and I asked her how to say it, chair-elect of the Board of Trustees from the American Medical Association, who's with us every year, and my good friend, Dr. Elena Rios, the president and CEO of the National Hispanic Medical Association. I must add, though, this year, this event is particularly special and so important for other reasons as well, largely because so many of the key provisions in the Affordable Care Act that all of us in this room worked so hard to see signed into law have been implemented. Today, because of the Affordable Care Act, millions of children and seniors already are enjoying the benefits of what happens when reliable access to affordable, high-quality healthcare services and treatment is expanded, to some for the very first time. Because of the Affordable Care Act, countless of not-for-profit organizations and educational institutions like the University of Delaware have been awarded grants to support their new and ongoing efforts to tackle health disparities and help achieve health equity. That's a major success. And the most recent success of the Affordable Care is, of course, the opening and enrollment in the health insurance exchanges in the HHS marketplace, and the over 8 million who are now signed up and benefiting. Despite the many states who are denying their lower-income individuals access to care by rejecting Medicaid expansion, even that where it's happening is a success. So despite what the naysayers say, and we know that they are relentless in their false rhetoric and scare tactics, many, many great strides to not only reform but to transform our nation's healthcare system have occurred, especially as it relates to reducing our nation's plight with uninsurance. And today, millions of formerly and underinsured children and adults now have affordable, high-quality health care and coverage. And that's worth applauding, so give yourselves a round of applause, because you were part of making this success possible. And I say that despite the fact that the territories like my district of the U.S. Virgin Islands are not fully benefiting from this expansion because none of us got enough funding to do an exchange. And there were limitations on how, and you'll hear about that tomorrow. So even with all of our gains, we have a lot of work left to do. We never thought this was going to be the be-all and end-all of our fight. This and other issues, the forgotten topics, are exactly what those that you will be hearing about and dialoguing about over the next couple of days. So everyone has an agenda for today, and if I do say so myself, there's a very ambitious and exciting set of sessions that showcase many of our nation's best and brightest, and that will cover a myriad of key issues that are germane to health disparity elimination. Throughout the morning and early afternoon, you'll have the opportunity to hear from and dialogue with the nation's premier experts working to reduce and eliminate disparities in cancer, hepatitis C, cardiovascular disease, diabetes, and chronic kidney disease, as well as depression, anxiety, and schizophrenia. We have some special presentations that I'm really looking forward to, and we'll be honoring some outstanding leaders. So we have a busy and exciting day, and I'm pleased to be working once again for the 8th year with the National Minority Quality Forum on this great event, and to have so many of you joining us today. I'm truly looking forward to 2 great days with you, with our presenters, our exhibitors, our many partners, and of course with Gary, Gretchen, and the National Minority Quality Forum. So we're all going to have 2 wonderful days, and I look forward to interacting with each and every one of you. Thank you for being here. Thank you.
I'm going to ask Dr. Icilma Fergus from the Association of Black Cardiologists to come up and bring some greetings.
Good morning, everyone. Good morning. Welcome. I'm very excited to be here representing the Association of Black Cardiologists for the 11th Annual National Summit on Health Disparities and the CBC Health Braintrust meeting. I would like to thank Dr. Gary Puckrein for inviting me here. It's my pleasure to be here. I'd also like to welcome and thank the members of the dais And I'd like to share with you a little bit about the Association of Black Cardiologists. The Association of Black Cardiologists was started in 1974 by a group of 17 individuals who were committed to improving the cardiovascular care of people in underserved communities, particularly African American communities. For the past 40 years, there's been a lot of work and input into communities and presenting at various forums such as this. And I'm happy to say that our organization has grown to over 2,000 professional members, mostly cardiologists, but many people who are dedicated and interested in reducing healthcare disparities when it leads to cardiovascular disease. In fact, our mission is to promote the prevention and treatment of cardiovascular disease and stroke in African Americans and other minorities so that healthcare disparities no longer exist in terms of cardiovascular disease. And that's why I'm here today, and that's why I'm so excited to be a part of this wonderful conference. You will be hearing from many of our members who will be talking on various aspects of heart disease. I hope that you're able to attend some of the sessions. I'll be talking later about cardiovascular disease in women. And there'll be many other interesting and important topics to be covered. Like Congressman Christensen, I would like to say that I think it will be a fabulous 2 days. There's a lot of information here to be shared. This is all very exciting. I'm looking forward to be a part of this. I'm happy to talk to each and every one of you. If you want to find out more about either joining the Association of Black Cardiologists, you don't have to be a cardiologist and you don't have to be Black to be a member, but if you're interested in working with us to reduce healthcare disparities and improving cardiovascular health, you too can be a member. So once again, thanks and welcome, and have a wonderful conference.
Now I'm going to ask Dr. Barbara McAneny, who's chair-elect of the Board of Trustees of the American Medical Association. I also want to say, as she comes up, that we've always enjoyed this partnership with AMA.
Thank you very much. It's a pleasure to be here on behalf of the American Medical Association. And I echo all of the comments about what a wonderful meeting this is going to be. I'm a practicing oncologist from New Mexico, where I deal with both diversity and disparities. And my specialty in oncology is now going through huge transformations as we learn about the differences in the human genome that make up these various cancers and the mutations and the diversity that can occur within a cancer. So as an oncologist, we tend to focus on those variations that cause cancer. But the majority of variations in the human genome simply cause the diversity that we see among all of our cells, and we consider those to be benign variations. The part that causes problem is when humans take those variations and create them into disparities. And the other determinant of how well people do in my specialty with cancer, the patients with cancer, depends not only on the genetics of their cancer, but on the disparities that they face in access to health care. This is something that I look forward to hearing about as we go forward with this meeting. One of the questions is, why do, for example, Black men do worse with prostate cancer, even if you control for access to insurance and to health care, et cetera? Why do I see so much gallbladder cancer among my Native American patients in our Gallup clinic? Why are all these things here? And then how do we relate to the compounding of that problem by the difference in poverty, education, nutrition, exercise capabilities, everything else that we see in humans? This is a huge problem that we need to work to address. And I'm very proud that the AMA has been a part of this organization and continues to work for this. You know, when I was a very, very young doctor, I went to the AMA for the first time and I looked around the room and I thought, I'm the only person here with hair. And I didn't go back for many years because I didn't feel welcome. But I did come back to the AMA, and it's obviously a major part of my life now. And the AMA now looks a lot more diverse than it did when I first started. And I'm very proud of the fact that the changes that we've made. It takes a strong organization to recognize that you made mistakes in the past. It takes a strong organization to apologize publicly for those mistakes and to prove that we're dedicated towards moving forward. And we are. And we have a long way to go, and everybody recognizes that. But we are truly committed to making the American Medical Association continue to be the voice of all of the doctors, taking care of all of the patients of America. And I'm so pleased to be here as part of this conference. It's my first time here, but I hope to be back many times. So thank you very much on behalf of the American Medical Association for attending this conference, and I look forward to your wisdom.
Everyone knows our next presenter. She's been in the fight and struggle for quite a long time, and she's been a tremendous partner. Dr. Elena Rios, President of the National Hispanic Medical Association.
Thanks, Gary. It's always a pleasure to be here, and thank you again, Gary, for inviting me this year. I can't believe it's the 11th year. This is great. So congratulations on the 11th Annual Health Disparities Conference, and of course the partnership with Congresswoman Donna Christensen and the Congressional Black Caucus. Braintrust is going to be very different without you, and we look forward to helping you in your next pursuits and whatever we can do to continue to work together. And I still want to go to the Virgin Islands. But anyway, I wanted to just call attention to the importance of the Affordable Care Act's results. And, you know, no matter what side of the aisle you're on, it has worked to increase the insurance availability, accessibility, and affordability, which is what the main purpose of that law was. 8 million signed up for health care insurance, according to President Obama earlier this month. 35% of those federally facilitated marketplaces are for people who were under 35 years old. 3 million young adults were able to stay on their parents' health insurance plans as a result, and 3 million more people enrolled in Medicaid or CHIP. I mean, this is just an incredible feat. And not only that, the costs of the health care and in general, because I don't know all the details, but the latest reports have shown that the premiums are lower than expected and will save this country $104 billion over the next 10 years. And the Medicare and Medicaid 2020 projected costs are $180 billion lower than expected. So, I mean, we have a lot to be thankful for all the advocacy of all of our partners and everyone in the room and all of your organizations. You know, I think it's great that we were able to see this happen. It's truly history in the making. So as the National Hispanic Medical Association, our focus is on the next generation now, and prevention, and the importance of educating all of our communities to get insured, or for those that have insurance to use it, and to see their doctors or their clinics and actually get engaged in more healthy lifestyle. That's really going to be the next generation's goal for healthcare. Besides, of course, eliminating health disparities by working with all of our offices of minority health that have been authorized through this legislation. That was one of the biggest accomplishments for everyone here. But I do think that the National Hispanic Medical Association is now poised to start working more in the regions. We started 6 regional steering committees in 2013, and we now have a database of 50,000 Hispanic, so-called Hispanic, I don't know if they're all Hispanic, but we've got databases now of Hispanic physicians and medical practices across the country divided up into 6 regions. And we're looking forward to our next generation of movement with the younger residents and medical students joining us and partnering with Gary and Health Disparities for the long haul. Thank you very much.
So there we are. We're ready to begin our sessions and look forward to speaking with you along the way. Lots of plans, lots of thinking to do. So please enjoy the day. Thank you so much.